Hello, my name is Scott Peake, and I'll be presenting a poster on increasing awareness of cognitive behavioral resources for therapists and also individuals with post-traumatic stress disorder. Clinical nursing problem that drove the initial spirit of inquiry driver PICO. Does cognitive behavior therapy, CBT, which includes cognitive processing therapy and prolonged exposure, reduce clinician-assessed symptoms of PTSD in adults versus treatment as usual or waitlist? PTSD can occur from varying events such as war, disaster, traumatic accidents, terrorist incidents, and sexual assault. A person diagnosed with PTSD must present with threefold symptomatology: re-experiencing the event, avoidance and numbing, and hyperarousal. Background and significance. The volume of affected personnel, including civilians seeking health care for these issues, poses a significant health concern for all advanced practice nurses. Awareness of these signs and symptoms of PTSD can lead to proper referral to mental health professionals such as psychiatric mental health nurse practitioners. PMHNPs need to be well versed in CPT or PE as well as other modalities in order to provide a variety of advanced effective treatments to treat PTSD. The purpose of the intervention was driven by initial literature searches and review that demonstrated effectiveness of CBT therapy, which initially included a broad area of intervention that involved education of therapists unfamiliar with PTSD. A focused dual-purpose evidence-based intervention was discovered. The primary purpose of this intervention project was to provide additional information and resources for mental health therapists to increase the effectiveness of existing CBT treatment. The secondary purpose of this intervention was to provide initial education regarding CBT therapy prior to beginning treatment. This was aimed at patients. Synthesis of literature review. 8 random controlled trials were examined in the author's original lit review. All of the studies revealed that CBT was effective in reducing self-reported and, in some cases, clinician-assessed symptoms of PTSD. Several articles and studies were found that created a narrowed focus in the proposed EBP intervention. The literature supported the need for patient education and involvement in the therapy process. Therapists need to have additional resources to share with patients. Project implementation. This investigator met with the clinical social worker to discuss CBT and its value in treating the Apache patient population. The CBT information sheet, which later morphed into a trifold brochure, was deemed to have value for this patient population. The revised format of the information sheet and the content was tailored specifically to the White Mountain Apache tribe. This investigator received positive feedback from the stakeholders, and this information was presented to the social services lead and social services personnel. Evaluation. The original intervention, as mentioned prior, was deemed outside the scope of this course. This author course corrected and achieved a significant intervention geared toward a specific patient population. Strengths of the project included that the EBT intervention was tailored to patient population, literacy, and culture. The intervention will definitely be utilized by current and future clinical social workers at this facility. This was per the lead clinical social worker. Changes in the project. These will be implemented in the future. The EBT trifold brochure will need to be modified, the written content, due to the fact that it has to go before a health literacy committee and have its content reviewed for relevance to the educational level of the patient population. This was based on the evaluation by the lead clinical worker. So in summary, CBT is effective. This is backed by the literature, and this patient population will benefit from increased utilization of this therapy. Thank you.